For this question, I will discuss the hormonal changes as well as the changes in the endometrial wall that happens during the menstrual cycle. So the first phase I would like to talk about is the proliferative phase. The other name for it is the follicular phase. And during this stage, Graafian follicles are producing estrogen. And what estrogen does is that it causes proliferation of the endometrial wall as well as increased vascularization. Now, because there is increased vascularization towards the end of follicular phase as well as part of the secretory phase, there will be edema of the uterus. So when estrogen level rises, as it passes a certain threshold, it causes increased luteinizing hormone. And what luteinizing hormone does is that it causes rupture of the follicle, and thus the oocyte will be released. Now, what remains of the follicle is referred to as corpus luteum, and it produces progesterone. And what progesterone does is that it's just like estrogen, it causes proliferation of the endometrial wall as well as vascularization. One critical change, however, is that it decreases uterine contractions. The other name for secretory phase, I should also mention, is the luteinizing phase. Now, what happens is that corpus luteum has a limited lifespan, and in the absence of human chorionic gonadotropin, it will degenerate, and once it degenerates due to decreased estrogen and decreased progesterone, the endometrial wall starts to shed and fall apart, and so that's the time that menses occur. Now, one other point I would like to mention here is that proliferative phase is variable in different individuals. So they can be like 3 weeks, or some individuals could be 1 week. So this phase, the duration can vary in different individuals. However, since the lifespan of corpus luteum in terms of days is like fixed, the secretory phase is always fixed for 14 days. Alright, so at this stage we just explained the changes that happens in the endometrial wall. Next, I would like to explain how Graafian follicles produce estrogen. So this is a schematic drawing of a Graafian follicle, and we have the theca externa here and then theca interna in this region. So these are the theca cells, and then the blue layer is the granulosa cells. And what happens is that upon stimulation by luteinizing hormone, theca cells will induce the conversion of cholesterol into androgen. And the enzyme that does that is the desmolase. And then later on, by stimulation via the FSH, granulosa cells induce the conversion of androgen into estrogen. And the enzyme that does that is the aromatase. So the mnemonic that you can use to always remember which cells are associated with what type of stimulation and what type of hormone is EFG. So you know how alphabetic letter is A, B, C, D. Just ignore those. EFG. So estrogen is produced by granulosa cells, which are stimulated by FSH, so EFG. Alright, now at this stage I would like to go over the hormonal changes that we just discussed. So Graafian cells will produce estrogen, and normally estrogen through negative feedback will decrease the production of luteinizing hormone. However, once it reaches a certain threshold, then it increases the production of luteinizing hormone. So luteinizing hormone will increase. And so what happens is that luteinizing hormone causes ovulation, so the oocyte will be released, and at this stage corpus luteum will be formed. And then luteinizing hormone keeps declining from here on. So there will be increased estrogen production until corpus luteum degenerates, and then it drops again. Now, the other hormone that is produced by corpus luteum is progesterone. So progesterone levels will also rise during this stage until corpus luteum degenerates, and then all decline. So once estrogen and progesterone decline, the endometrial wall starts to shed, and that causes menstruation. Now what happens is that if there is fertilization, then the blastocyst will implant on the uterine wall and induces the production of human chorionic gonadotropin. And what happens is that this human chorionic gonadotropin has a similar function to luteinizing hormone, and it causes the corpus luteum to be maintained. So corpus luteum does not degenerate in the presence of human chorionic gonadotropin. So if fertilization happens, then corpus luteum continues to increase the production of estrogen and progesterone for the first 40 days of pregnancy. And after that, placenta will take over and continue production of estrogen and progesterone. Alright, so that concludes our discussion, but I would like to go over everything that I explained one more time and just summarize what I explained there. So here we have the changes that occurs during the endometrial wall during the proliferative phase, which can vary in different individuals from 7 to 21 days. Graafian follicles produce estrogen, which causes proliferation of the endometrial wall as well as increased vascularization. Increased vascularization towards the end of proliferative phase causes edema of the uterus. Then once LH level rises, it causes the follicle to rupture for the oocyte to be released, and what remains of the follicle is called corpus luteum, which increases production of progesterone and estrogen. So progesterone continues to proliferate the endometrial wall as well as vascularization, but what happens is that because of increased progesterone, there is decreased uterine contractions. And then in the absence of human chorionic gonadotropin, corpus luteum degenerates, and once it degenerates due to decreased progesterone and decreased estrogen, there would be constriction of these endometrial vessels, and thus there would be ischemia and the endometrial wall will start to shed, and that is called menses. Now, given that the lifespan of corpus luteum in the absence of beta-HCG is limited, then the secretory phase is always fixed in different individuals. It's 14 days. So while the proliferative phase can change in different individuals, secretory phase is always 14 days. Regarding the production of estrogen by Graafian cells, pulsatile stimulation of gonadotropin releasing hormone causes increased production of SH and LH. LH acts on theca cells to induce the conversion of cholesterol into androgen by the enzyme desmolase. And then later on, FSH acts on granulosa cells to induce the conversion of androgen into estrogen by the enzyme aromatase. And the mnemonic that you can use to remember all these is called EFG. So estrogen, FSH, and granulosa cells. Alright, now let's summarize the hormonal changes that occurs during the menstrual cycle. So here we have estrogen that is increased by Graafian follicles, and then once estrogen reaches a certain threshold, it induces the increased production of LH. So increased estrogen and increased LH induces ovulation, and once that happens, then the corpus luteum will be formed, and corpus luteum will increase production of progesterone and estrogen, and in the absence of HCG, corpus luteum degenerates. Once these levels drop down, then menstruation occurs. So menstruation occurs because of decreased estrogen and progesterone. However, if fertilization occurs, then blastocyst will implant on the uterine wall and increase production of HCG. HCG acts like luteinizing hormone, and it acts on corpus luteum to help maintain it. And once corpus luteum is maintained for the first 40 days of pregnancy, corpus luteum will continue producing progesterone and estrogen, and then after that, placenta will take over. And that concludes our discussion.